Have you ever looked at your nails and wondered why they change color, shape, or texture over the years? Many seniors think these changes are simply part of aging, but your nails are often the very first place where your body reveals hidden health issues. Doctors now understand that your nails act like tiny health diaries. They quietly record months of information about your circulation, your oxygen levels, your nutrition, and even how well your organs are functioning. So if you're over 60, your nails may be telling you far more than you realize. Every ridge, every color shift, every curve or line carries a message, and today we're going to translate those messages together. In fact, take a quick look at your nails right now. Their shape and color might already be showing you something important. And one of the signs we'll cover, number 3, is so easy to overlook that most seniors miss it completely, even though it can appear months before a serious circulation or oxygen problem. So let's begin with one of the most common changes people notice, but one that can reveal more than most realize. Black vertical streaks, important to know. There's one nail change that deserves its own moment of attention, because it can carry more weight than many people realize. If you ever notice a single dark vertical streak running from the base of your nail to the tip, especially one that wasn't there before, it's important not to ignore it. Now, a dark line isn't always dangerous. People with naturally darker skin tones often get harmless pigmentation lines. Some lines come from old injuries or small changes in the nail bed. But there is a very specific type of streak that doctors pay close attention to. A dark line that does not grow out with the nail, becomes wider or darker over time, or appears on just one nail. In rare cases, this can be an early sign of something happening underneath the nail, including a form of skin cancer that grows in the nail bed. It usually begins quietly, without pain or swelling. Many seniors don't notice it right away because the rest of the nail looks normal. Here's the most important thing to look for, is the line changing. Healthy nail pigment will move forward as your nail grows, but a dangerous streak will stay in the same place, or slowly widen at the base. Sometimes the skin around the nail may darken as well. This section isn't meant to scare you. It's meant to empower you. When caught early, these issues are highly treatable. The key is simply awareness. So if you ever notice a new black streak on just one nail, or a line that seems to be getting darker or thicker, mention it to your doctor. A quick look can give you answers and peace of mind. Your body always prefers to whisper before it shouts. And this is one of those moments when listening early makes all the difference. Vertical ridges. If you're over 60, you may have noticed small vertical lines running from the base of your nails to the tips. Many people simply assume this is part of aging, and sometimes it is. As we grow older, nail growth naturally slows down, and those lines can become more visible. But here's something most seniors never hear. The depth and sudden appearance of these ridges can give you important clues about what your body has been dealing with. Think of your nails like the rings of a tree. Every line represents a moment where your body may have been under stress. Maybe you were sick. Maybe your digestion wasn't absorbing nutrients well, or maybe your thyroid was working overtime. If you see deeper grooves, especially if they show up on several nails at the same time, it may mean your body didn't get enough of the building blocks it needed for a little while. Sometimes it's low iron, sometimes low B12, sometimes your gut simply didn't absorb things properly. Here's a simple way to look at it. Instead of seeing ridges as separate pieces of information, think of them as part of a story. Shallow lines often reflect gentle, natural aging. Nothing to worry about. But when the ridges become deeper and more sharply defined, especially if they appear on several nails at the same time, it suggests that your body may have gone through a period where it didn't get everything it needed. That could be lower iron, lower B12, or even a moment when your digestion wasn't absorbing nutrients well. When you notice these deeper grooves, don't feel alarmed. See them as a quiet nudge from your body, saying it might need a bit more support. A small change in diet or a simple conversation with your doctor can already help a great deal. Bowes lines, horizontal grooves. Now, let's look at something many seniors notice only after a period of illness or stress, though most people don't know the true meaning behind it. These are the horizontal grooves that run straight across the nail, not up and down like the ridges from before. They're called Bowes lines. Bowes lines appear when your nail growth pauses for a moment and then starts again. It's your body's way of leaving a small mark that says, "Something interrupted me here." And what's fascinating is that these grooves can actually help you understand what your body went through, and even when it happened. Imagine a tree pausing its growth during a drought, only to continue when rain returns. Your nails work the same way. If you once had a high fever, a strong infection, surgery, or a period of intense stress, your nail matrix, the part that forms new nail, may slow down briefly. Weeks later, that pause shows up as a horizontal line. Here's something interesting. You can even estimate the timing. Nails grow slowly, only a couple of millimeters per month, so if the groove sits halfway up your nail, your body likely experienced that stressful moment about 6 to 8 weeks ago. Many seniors tell themselves they're just aging when they see these lines. But Bowes lines aren't about aging. They're about history. They're a quiet record of a moment when your body needed more support, and noticing them can be a powerful reminder to take things a little easier. Nourish yourself well, and check in with your doctor if you've had repeated episodes. Spoon nails, koilonychia. Now let's talk about a nail change that's easy to overlook because it often happens slowly: spoon-shaped nails. If you gently run your finger over the surface of your nails and notice that they dip inward, almost like a tiny bowl or spoon could hold a drop of water, this is something worth paying attention to. Many seniors assume this is simply a cosmetic change, but spoon nails can be one of the earliest signs that your body isn't getting or using iron the way it should. Iron plays a key role in carrying oxygen throughout the body, including to the cells that build your nails. When those cells don't get the oxygen they need, the nail can't form its normal, strong, slightly rounded shape. Some seniors with spoon nails also notice other subtle changes: feeling tired more often, shortness of breath during simple activities, cold hands or feet, or even cravings for ice. These small clues can add up to a larger picture. But here's the comforting part. Catching this early can make a big difference. Iron levels can be measured easily, and improving them often brings back energy, warmth, clearer thinking, and stronger nails. And sometimes, spoon nails can appear because your body struggled with thyroid function, or your digestion wasn't absorbing nutrients well for a period of time. So if your nails have taken on this gentle, scooped shape, don't ignore it. See it as your body whispering for a bit more attention, a reminder to check in on your iron levels, your thyroid, or your digestion. Listening to these early signals helps you stay active, steady, and energized in your daily life. Yellow or thickened nails. Now let's move to one of the most common changes seniors notice. Nails that turn yellow, become thicker, or grow more slowly than they used to. Many people assume this is just aging, but your nails often have a very specific reason for changing this way. Yellowing can happen when the nail grows more slowly than normal. As we get older, circulation to our fingertips can decrease slightly, and when that happens, the nail doesn't move forward as quickly. When new nail growth takes longer, the older part of the nail can take on a yellow tint. But here's something important. Slow-growing, yellow, or thickened nails can also be signs of deeper issues. Sometimes the body is dealing with a mild fungal infection that never fully goes away. Other times, the lymph system, which helps remove waste and fluid from the body, isn't moving as well as it should, and in a few cases, yellow nails can be linked to breathing or circulation challenges. One thing many seniors notice is that their nails not only turn yellow, but also start to curve or thicken at the tips. This often means the cells that create the nail aren't getting the oxygen or support they need. Some people describe it as their nails feeling heavier or harder to trim. If you've noticed your nails becoming yellow or thicker over time, don't feel alarmed, but do pay attention. Sometimes a gentle reminder to check your circulation, breathing, or even a simple fungal treatment can help restore the natural look of your nails. And if you've ever had trouble with swelling in your legs or ankles, or felt short of breath more often than you used to, yellow or thick nails may be one of the earliest signals your body is giving you. Your nails don't change without a reason, and understanding their messages helps you stay ahead of what's happening inside your body. Blue or purple-tinted nails. Now let's look at a nail change that often surprises seniors because it can come and go. Nails that appear slightly blue, purple, or grayish in tone. Sometimes the color shift is subtle, and other times it's more noticeable. But whenever your nails take on a bluish tint, your body is giving you a very specific message. This color usually appears when your nails aren't getting quite enough oxygen-rich blood. It doesn't always mean something serious, but it does mean your circulation or breathing may not be working as smoothly as they used to. Many seniors notice this when their hands get cold easily, or when they've been sitting still for a while. Others see it when they walk up a flight of stairs, and suddenly their fingertips look a little dusky or darker than normal. Here's what's happening inside the body. Your blood carries oxygen to every part of you, including the cells that form your nails. When oxygen levels drop even slightly, the nails can lose their healthy pink glow and take on a blue, purple, or grayish tint. It can be a simple circulation issue, especially if your hands and feet often feel colder than the rest of your body. But sometimes it can be a clue about your lungs or heart, especially if the color change happens during activity or comes with shortness of breath. Now, this doesn't mean you need to panic. Blue or purple nails are often one of the earliest, gentlest signs that your body wants to be checked. A simple conversation with your doctor or a quick oxygen or circulation test can give you peace of mind. Your nails are small, but they are honest. When they shift color, even slightly, they're reminding you to slow down, pay attention, and take care of the engine that keeps everything running, your heart and lungs. Brittle or easily breaking nails. Now let's talk about something many seniors deal with but rarely understand the full meaning of. Nails that split, peel, crack, or break with the slightest pressure. It can feel frustrating. You trim them, care for them, maybe even moisturize them, yet they still seem fragile. But brittle nails are more than just a cosmetic issue. They often reflect what's happening deeper inside your body. As we age, our nails lose some of their natural moisture, and the body's ability to hold on to certain nutrients may change. But when nails become unusually dry or start peeling in thin layers, almost like tissue paper, it can be a sign that your body isn't getting enough of the essential nutrients it needs to build strong nail cells. Low levels of iron, B12, zinc, or even protein can weaken the nail matrix, the part that forms new nail. And when that area doesn't get enough support, the nails simply don't grow out as strong as they used to. Some seniors also notice brittle nails when their thyroid is slowing down. The thyroid helps regulate growth, energy, and repair processes in the body, and when it's underactive, the nails are often one of the first places you see the change. You might also notice other hints, feeling more tired than usual, dry skin, thinning hair, or feeling colder than others around you. These small clues can be connected. The good news is that brittle nails are often very responsive once the body gets what it needs. A few adjustments, like improving hydration, adding nutrient-rich foods, or checking your thyroid or iron levels, can help restore strength and smoothness to your nails. So if your nails have been breaking more easily lately, don't see it as a sign of weakness. See it as your body gently asking for a little more care, nourishment, and attention. It's a reminder that small changes can bring lasting improvements to your well-being. Clubbing, rounded or bulging nails. Now we move to one of the more noticeable, yet often misunderstood, changes. Nails that slowly become rounder, smoother, or slightly bulging at the tips. Many seniors don't realize it's happening until someone points it out, because clubbing usually develops very gradually. At first, the nails may simply look a bit more curved than before. Over time, the tips of the fingers can appear fuller or rounder, almost as if the nails are sitting on a small cushion. The shine of the nails may also change, becoming smoother or more glass-like. While this change is painless, it's important to understand what the body may be signaling. Clubbing can occur when the fingertips aren't receiving enough oxygen over a longer period of time. The body responds by increasing blood flow to the fingertips, causing the tissue to swell slightly and the nails to change shape. This can sometimes be linked to the lungs or heart, especially if breathing has become a little harder over the years, or if climbing stairs leaves you more winded than it used to. Some seniors also notice slight swelling in the fingertips or find it harder to grip small objects. Remember, this doesn't mean something is wrong right now. It simply means your body may have been adapting quietly for a long time. And noticing clubbing early gives you valuable time to check your oxygen levels, lung function, or circulation with your doctor. Your nails won't nag or shout. They whisper. And clubbing is one of those whispers that says, "Let's slow down and check how things are working on the inside." Paying attention to this gentle signal can help you protect the strength you value most, the ability to breathe comfortably and move with ease. Pale or white nails. The final sign we'll look at is one that many seniors overlook because it often feels subtle. Nails that lose their natural pink color and begin to look pale, washed out, or almost white. This change can happen slowly, which makes it easy to dismiss, but it can reveal something meaningful about what's happening inside your body. Healthy nails have a soft, rosy glow because of the blood flowing underneath them. When that healthy color fades, it may mean your blood isn't carrying as much oxygen as it should, or that your body doesn't have enough of the nutrients needed to maintain strong, vibrant nails. Some seniors with pale nails also notice they feel more tired than usual, or they get lightheaded when standing up. Others may feel colder than those around them, or notice shortness of breath during everyday activities. These small signs can all be connected. Pale nails can sometimes be related to lower iron or B12 levels, both of which play important roles in forming healthy blood cells. In other cases, they can be a gentle clue that your liver or circulation needs a bit more support. Here's a simple way to notice the difference. Gently press the tip of your nail until it turns white, then release it. A healthy nail should return to its rosy color within a couple of seconds. If it takes longer, this may be a nudge from your body to check in on your blood or your overall nutrition. If you've noticed your nails looking paler over time, take it as your body's way of asking for a little more attention. It's not a cause for panic. It's an opportunity. With a few checks and the right support, your energy, warmth, and overall vitality can improve more than you might expect. When should you see a doctor? Now that you've learned how much your nails can reveal, it's important to know when a change deserves a closer look. Most nail changes are gentle whispers from your body, not emergencies. But some signs are worth bringing to your doctor's attention so you can stay ahead of any hidden issues. You should consider checking in with a healthcare professional if you notice any of the following. A nail change that appears suddenly, especially if it's on several nails at once. Any dark streak that does not grow out with the nail. Nails turning blue or purple more often, especially during simple activities. Severe thickening or yellowing that continues to worsen. Pain, swelling, or warmth around the nail. Nail changes paired with fatigue, shortness of breath, dizziness, or cold hands and feet. Remember, seeing a doctor isn't about fear. It's about clarity and confidence. Many of these signs have simple explanations and easy solutions. And even when something does need attention, catching it early gives you more control and more peace of mind. Your nails are there to help you, not to alarm you. When something looks different and stays that way, think of it as your body inviting you to check in, take care of yourself, and make sure everything inside is working the way it should. A caring message. Your nails may be small, but as you've seen today, they can speak volumes about what's happening inside your body. They're not here to frighten you. They're gentle guides, helping you notice changes early so you can stay strong, steady, and confident in your health. If any part of this video helped you understand your body a little better, that's already a win. And if you found a sign that made you pause or reflect, remember this: awareness is one of the greatest gifts you can give yourself. The earlier you notice something, the easier it is to support your health and keep enjoying the life you love. And here's a caring reminder. This video is for education, comfort, and guidance. But it's not a diagnosis. Every person is unique, and only a healthcare professional who knows your history can give you clear answers. So if something in your nails has been worrying you, please don't hesitate to reach out to your doctor. Not because you should be scared, but because you deserve clarity and peace of mind. Thank you for spending this time with me. Take good care of yourself, stay curious about your health, and remember, your body is always trying to help you. All you have to do is listen.